This is a public service announcement on the ethical issue of healthcare accessibility. The topic of healthcare accessibility is a hard one to discuss because so many factors contribute to the ethical dilemma of how someone should be able to get medical help. Therefore, this public service announcement will focus on how medical cost affects healthcare accessibility. Healthcare expenses are on the rise, making it harder and harder for the average American to get the help they deserve. As the common saying goes, the world revolves around money. But how does this affect and impact the lives of millions of Americans when they are trying to pay for their healthcare, and what could be done to help make this a little less challenging for them? Before I can even begin to attempt to answer these questions, I need to first lay out the foundation of the ethical issue I'm speaking about. Healthcare accessibility, according to the Centers for Disease Control and Prevention, is an ethical issue that focuses on the access to healthcare, primary care, health insurance coverage, and health literacy of a patient. It is also one of the main categories of the social determinants of health and the goals for the Healthy People 2030 program, a United States initiative that focuses on improving the overall livelihoods of all people. Healthcare accessibility has also become such a significant ethical issue because it relates to the principle of distributive justice, which is defined to be, according to the American Medical Association Journal of Ethics, the, quote, fair and equitable distribution of health resources, end quote. So, for example, if a patient cannot afford the healthcare resources they need, then there is no fair distribution of said resources, since they are being distributed only to the patients who can afford them. This begins to separate populations based on their ability to pay, making the distribution of healthcare resources unfair and sparking an ethical issue involving healthcare accessibility based on cost and the principle of distributive justice. Now that the foundation has been established, we can see how the difficulty of accessing healthcare based on cost affects the average American. The average annual U.S. income for an American is around $63,000, but this doesn't take into account the different costs of living and inflation rates that differ from state to state. It also doesn't take into account how much money they are able to bring home after taxes, insurance, bills, and other required expenses, and the fact that the middle class of America is slowly being flushed out, according to the Pew Research Center. For the 2024 Pulse Trends Report, which provides updates on consumer financial health, it was discovered that 70% of American households are relatively financially unhealthy, with this reality only getting worse and worse. All in all, accessibility to healthcare for the average American is becoming more and more limited due to these financial difficulties and this added increase in total national healthcare spending, which has, quote, doubled since the year 2000 after inflation from $2.2 trillion to $4.9 trillion as of 2023, end quote, according to US Today. This in turn is requiring an individual to have to pay more either out of pocket or on their deductibles for their medical expenses, which can put a lot of strain on the household or individual if they are barely managing with their finances as is. The reason healthcare has become so expensive, however, is due to several reasons, including new technological advancements and resources that are too pricey for patients to afford, and a rising population of adults at least 65 years or older who may drive the cost of Medicare up over time, according to the Peter G. Peterson Foundation. To break this down, when there are improved technological advancements added into a hospital, the investments on the hospital's end to purchase the equipment in the first place forces them to increase the average price of care for a patient in order to offset the cost. While it can be argued that adding these new technologies can make the healthcare process easier, faster, and more accurate for the patient, the increase in cost can be a strong driving force for a patient to want to avoid the hospital when in need of care. There is also an increase in the aging population needing care in the future, which is expected to increase the number of enrollees for Medicare, which is projected as a whole to therefore double Medicare spending costs over the next 30 years. But while the increase in technological advancements and an aging population are two large driving forces in why healthcare has become so expensive, there are many other forces also driving the cost of healthcare upward. Now that we've established and explored this foundation of healthcare accessibility in terms of cost, though, we can now determine what can be done to help make this ethical challenge a little less daunting. Reducing administrative costs, focusing on preventative care, removing unnecessary procedures, and controlling the costs of prescription drugs are the top healthcare reforms that come to mind in order to help make healthcare more affordable. According to the American Journal of Medicine, a study found that $210 billion are wasted annually on unnecessary billing and administrative costs. The medical school curriculum lacks in training medical students in preventative care skills. Many unnecessary tests are performed to prevent malpractice suits, and citizens in other countries pay 20% to 40% less for prescription drugs compared to what Americans pay. Some ways to implement these reforms, therefore, include having a single payer, which is also a non-profit national healthcare insurance, available instead of several different insurance companies to save 15% of healthcare costs, encouraging more medical school students to become adult generalists so more students can be trained in new preventative care programs, increasing the amount of research funding to help determine which tests and procedures are more beneficial for an individual patient, and having the government step in to help control the prescription drug costs so they aren't driven up faster than patients can keep up. Overall, this ethical issue of how the average American can access healthcare despite its growing costs is becoming more distinguished, but establishing and exploring the foundations of this ethics issue helps highlight why there are no easy solutions to solving it yet. While the before-mentioned solutions can definitely help navigate these growing costs, though, other, more complex and long-term solutions are still needed to fully conquer this ethical issue. Therefore, American citizens, healthcare professionals, insurance companies, and the United States government, among other well-established groups, should be collectively called upon to help determine more thorough and long-term solutions to this growing problem, so the American healthcare system doesn't become ultimately overwhelmed in the coming years. To recap, this was a public service announcement on the ethical issue of healthcare accessibility, and thank you for watching.